Well, good afternoon. The last couple of months have been in a real fight for our lives against this virus. It's a fight that has taken a heavy toll. Some have lost their jobs. Some have lost their customers. Some have had deeper losses. A father, a mother, a grandparent, a friend. That kind of grief and stress, it has an impact, not only on our physical health, but on our mental health too. At a time when we all must practice physical distancing, it can be isolating, not seeing family or friends for weeks. It can be isolating, not having anyone call or check in. It can seem like you're going through the emotions, trying to get through each day when each day looks the same. It creates stress, anxiety, and depression. So if you're listening to this, my message to you is simple. You're not alone. We will support you. We will get through this together. It's more important than ever to reach out, to check on our seniors, and to make sure we're taking care of each other. During this time of physical distancing, let's continue to stay in touch. That's how we'll beat this virus. And my friends, the good news is help is here. To support those struggling with mental health during these difficult times, our government has invested $12 million into virtual and online mental health supports. And this week, we're rolling out expanded access to those critical supports at no cost to patients. These mental health supports can be accessed safely from home. You can take an assessment and receive support from a therapist. And we know many of our frontline heroes need support too. They're the ones in the trenches. They're the ones working 12-hour shifts. Their jobs can be stressful and demanding, but every day they get up and they go to work. They help people and save lives. They're absolute heroes. They're superheroes, if you ask me. And I can't thank them enough for everything they do, day in and day out. They take care of us, and we're going to make sure we take care of them too. These new virtual mental health supports will also be available to our frontline workers whenever they need it. We've been working closely with our hospitals and Ontario Health to deliver these supports, including online peer support groups and access to mental health workers. We'll make sure everyone has the support they need to stay well in mind and body, because mental health is health. Thank you, stay well, and God bless the people of Ontario. Now I'll hand it over to Minister Tibollo.
Thank you, Premier. The unfortunate reality is that there is a tendency during these highly disruptive and stressful times for people to not always take the time to look after themselves or to check in with a friend, a colleague, or a loved one to see how they are really feeling. En ces temps très perturbateurs et stressants, les gens ont tendance à ne pas toujours prendre soin d'eux-mêmes ou à consulter un ami ou un être cher pour voir comment ils se sentent. That's why I'm proud to be here today to announce that in partnership with MindBeacon and Morneau-Chapelle, our government is significantly increasing access to internet-based cognitive behavioral therapy programs for those experiencing heightened anxiety and depression during the COVID-19 pandemic, including our frontline healthcare workers. C'est pourquoi je suis fier d'annoncer que notre gouvernement augmente considérablement l'accès au programme ICBT pour ceux qui souffrent d'une anxiété et une dépression accrue pendant la pandémie de COVID-19. In addition, we are also proud to announce that we have established a mental health and addictions COVID-19 response table chaired by the Ontario Mental Health and Addictions Centre of Excellence within Ontario Health. Members of this response table represent organizations across the mental health and addiction sector and are laser focused on ensuring that available supports are maintained during the COVID-19 pandemic. Drawing from their expertise within the sector, members will share best practices and connect with other COVID-19 tables to ensure any issues impacting our mental health and addiction system are quickly resolved. Our government's overriding priority is to ensure all Ontarians have access to the high-quality services and supports they expect and deserve, especially during these unprecedented times. And we will continue to listen and work collaboratively across government to ensure Ontarians are fully supported in their journey towards mental wellness. Thank you, merci, and I now turn it over to Minister Elliott to say a few words.
Thank you and good afternoon. Since the start of the COVID-19 outbreak, our government has been driven by an unyielding commitment to protect the health and well-being of Ontarians. And as we all know, there is no health without mental health. As a result of the COVID-19 outbreak and what it has demanded from everyday Ontarians, more people are experiencing stress, anxiety, and other mental health issues. To every Ontarian who has helped to flatten the curve and stop the spread of COVID-19, thank you. I know the sacrifice it has taken, including missing time with friends and loved ones. There is no better time than during Mental Health Week to ensure that we are supporting those who have so bravely supported Ontario, including everyone doing their part by staying at home, and of course, our heroic frontline healthcare workers. We are supporting Ontarians by significantly increasing access to internet-based cognitive behavioral therapy and by developing a suite of services for frontline healthcare workers, including self-referral and intake services, as well as weekly online peer discussion groups and access to confidential support from clinicians. I encourage everyone who may be struggling to visit ontario.ca/coronavirus to learn more about the supports that are available. These are difficult times, no question, but together we will get through them. As we do, we are ensuring Ontarians have access to the supports they need when and where they need them, which right now means in the safety of their own homes. Thank you.
Well, before I take any questions, I want to address one more thing. As you all know, last week we tragically lost members of our Canadian Armed Forces in a helicopter crash. Tomorrow, we will pay tribute to those brave men and women in virtual Highway of Heroes ceremony starting in Trenton. Because of COVID-19, we're encouraging everyone to watch from their homes to pay their respects instead of gathering along the highway. This ceremony will start at 2:30 p.m. and will be live streamed on all Canadian Forces social media channels. Again, my sincere condolences to the family, friends, and loved ones of these aviators and sailors. We will never forget them. God bless them.
We'll go to the phone line for questions. Just a reminder, one question, one follow-up. First question.
Your first question comes from Travis Darraj with Global News. Please go ahead.
Hi there, Premier. Good to talk to you today.
Hi,
It's been a couple of days. Two questions for you, actually.
Yep.
A lot of grocery stores, garden centers, and other organizations such as Ottawa Transit are telling customers they need to wear masks right now. And as more businesses open up, we are likely going to see a lot more of this. Now, I know that you have said for weeks that we're trying to ramp up supply, but what is your recommendation for people right now if they can't get a mask? And do you think everyone should be wearing face coverings in public?
Well, I know one of the big retailers are requiring people to wear masks, one of the big box retailers, before they go in. And when I spoke to one of the doctors on the health table, he said even a scarf is better than nothing at all. So if you have a scarf, wear a scarf if you can't get a hold of any of the surgical masks. We're doing everything we possibly can, Travis, to make sure that we get the masks. But I do, and I've always said, as soon as I get information, I'll pass it on. I was on our procurement table call this morning that we have every single day. They told me if there's one area that we see that we need some support in, it's gowns. And it's not just us, it's the fabric. So we have the domestic suppliers manufacturing these gowns, but right now, around the world, the fabric seems to be the problem.
Follow-up?
And a second question for my colleagues at Global National in Vancouver. The World Health Organization is urging countries to investigate any suspicious early cases after reports that COVID-19 emerged in France in December. Is Ontario looking into or planning to look into suspicious cases?
Well, definitely. We'll look into it, and I'll pass out to the health table to see if we can look into any suspicious cases from France.
Next question.
Your next question comes from Lisa Zing with CBC. Please go ahead.
Hi there, Premier. Toronto Western is reporting 4 outbreaks, as we read in the Star. And in March, the ministry gave hospitals some leeway to free up space and staff, which gave them some flexibility to deal with COVID-19. What exactly do you know about how these outbreaks happened at Toronto Western, and do we need stricter guidelines for hospitals to follow?
Lisa, I'll pass this over to the Minister of Health.
Well, we're certainly aware of the outbreak at Toronto Western. They're handling a volume of patients with COVID-19. And so what is happening there right now is the deep cleaning is being done as necessary for proper protection and control. People are being moved to places where they will be safer. Staff are, of course, being screened. But we have been supporting our hospitals. They have their own control procedures, of course, but we did give them a huge increase in the economic statement, 5.5% increase to hospitals, the biggest increase in a decade. We have been working with them throughout to allow them to do internal deployment of staff so that they can have the right staff in the right places at the right time. And now, of course, that's been extended to long-term care homes as well. So they are following the accepted procedures. They are doing the right things at getting the outbreak under control, but we have been providing them with assistance in many ways.
Follow-up?
Thanks very much. And this one either for the Health Minister or the Premier. The SEIU, which represents about 60,000 healthcare workers, just announced they're calling on the province to launch a public inquiry into the deaths of staff and residents at long-term care homes. Is this something the province is considering?
Well, I'll pass this back over to the Minister of Health, but I can tell you we are doing everything in our power, not just ourselves, everyone is doing everything in their power to make sure that people in long-term care have sufficient PPE. When they call, they get it. We've been able to move some hospital staff, frontline healthcare workers over to long-term care. We've called the military in. We're pulling out all stops on this, but I'll pass this over to the Minister of Health.
Well, as the Premier indicated, we have been focusing all of our efforts on supporting the people in long-term care homes, the people who are working there. We have issued a number of directives for many weeks, including most recently that there are no people allowed to visit long-term care homes except for if a death of their loved one is imminent. We have employed the use of hospital workers to go in to provide both infection protection and control as well as for staffing. And of course, we have the assistance of the armed forces. So many steps have been taken, and we will continue to take those steps until these outbreaks are under control to make sure that the long-term care homes are properly staffed once again, that people are going to come back to work. So this is not something that's one or two issues that we have to deal with. There are a number of issues, and we have been working alongside our colleagues in long-term care homes as well as our colleagues in hospitals as well as the armed forces to make sure that people can stay safe and healthy in the long-term care homes in the future.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi there. My question is for the Premier.
Mhm.
It's on the issue of cottages. You mentioned yesterday that you'll be speaking with the mayors of cottage country about people being allowed to go to their cottages perhaps by the Victoria Day long weekend. And so our question is, what if those cottage owners want to rent to a small family or a small group? Would that be all right if the group is smart about it by bringing their own supplies and staying within the confines of the cottage property?
I'll have that conversation on Thursday with the regional mayors up in cottage country, and 3 weeks down the road, hopefully. And this is all based, I want to make sure we're clear, this is all based on seeing the numbers continue to go down in the public domain. So we'll talk to the mayors tomorrow, have that wholesome conversation. But again, it's going to be hard to hold back people going back to their cottages. I've said before, I'm getting calls about why should I pay my taxes if I'm not allowed to go up to my cottage? I understand it, but I just want to make sure that when that time comes, if it does come, and hopefully it will, that people bring up their own supplies and they don't go into town. Even though when I spoke to one of the mayors, he said, you know, it's not an issue right now in the hospital. It's not an issue with food in the stores. So I think we go up there and not we, but the people that have cottages go up there and bring their own food until we move along further in June and July. On the other note, that the people that have businesses up there rely on cottagers to keep their businesses going.
Follow up.
And is regarding money lenders and money lending companies. Is there any plan to cap their interest rates during this pandemic and these tough economic times?
Well, you mean the quick cash places?
That's right.
I don't know. I'm just not in favor of a lot of these people charging astronomical rates, but that's a conversation I'll have with the finance minister. And again, that's some of these interest rates are just through the roof. So, you know, if you can, try to go to the bank, much better rates.
Next question.
Your next question comes from Christina Tanelia with CP24. Please go ahead.
Oh, hi, Premier. Thanks
Hi,
so much for taking my call today. It's been a while. I know Haley just asked about cottage country, but we've heard from a number of cottage country mayors all day today on CP24, and they're concerned about the May long weekend. So I know you have this chat coming up later this week, but if you could just give perhaps some insight for people with recreational properties. There really is no travel ban in place for people to not, like, I mean, you're not supposed to leave home if you don't have to.
Yep.
But I guess what I'm wondering is it really a big problem for someone, you know, a family, people who intimately spend time together to just drive up with their own food, hang out at their property? Any insight you could provide us with now, recognizing that Haley, you gave some insight to Haley.
Yep. So on May the 24th, 3 weeks down the road, hopefully the numbers will be down. And keep in mind, Christina, you nailed it. You said there's been no order. And to all the mayors up north, you've done an incredible job, but the people that own cottages have done an incredible job too. We've asked them to stay away, and for the most part, people have stayed away just on asking. So the people of Ontario are incredible. You know, you ask them, please stay away, they stay away. But there's no order, you know, on the table right now, and there won't be. People are cooperating. So we have to give it a little bit of leniency. If you put down the hammer and say you just aren't coming, well, people aren't going to listen. I want to make sure we get collaboration from all the communities and all the mayors. Be prepared. People are coming up on May the 24th. But in saying that, I truly believe that the people are going to bring their own supplies. They're going to bring their own food. They're going to stay at their cottage. People won't be going into town as much as a typical May 24th weekend. But let's see what happens. I could be wrong. But I just don't see there's going to be a massive issue 3 weeks down the road.
Okay, thank you, Premier. My second question is about the school year for those in colleges and universities come September. Perhaps you're aware of a report that's out saying, you know, students who attend post-secondary institutions can likely expect online learning to continue or their courses to be online in September. Is that something you support? Is that coming from the government in terms of instruction? I mean, I know colleges and universities can essentially make these decisions on their own, but is that what students should anticipate?
Well, I think we need to talk to the students. We need to talk to the colleges and universities. And I know Minister Romano is on that phone every single day. There isn't one college, one university he hasn't reached out to. And well, again, every decision our province has made through this COVID, it's talking to the stakeholders, making sure they're okay with it. And we're going to continue talking to the colleges and universities. But he said something that was very, very interesting to me. He said, Doug, over 100,000 online courses were taken, and we did that in a matter of less than a couple of weeks. He goes, if we didn't have COVID, it would take us 10 years to do that. So it's amazing when everyone in Ontario pulls together and we're rowing in the same direction, we're on the same team, how things can get done. And I want to thank all the colleges and universities. They've been absolutely incredible. Not to mention just online, but also on research. There's universities out there, and then the colleges supporting us when it comes to nurses coming out of the colleges and being able to go right into the front lines. I just, that's my number one selling feature when I travel around the world, and especially in the U.S. Our number one selling feature are the young people coming out of our colleges and universities. They're the smartest, they're the best anywhere in the world. And we're going to continue making sure we produce the best anywhere in the world when it comes to the colleges and universities.
Next question.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. Wanted to ask you about the mental health announcement today. In Toronto, in March and April, there have been surges of drug overdoses, fatal drug overdoses. And a lot of services for people who've been going to safe consumption sites have been scaled back because of the pandemic. And a lot of the stay-at-home self-isolation measures actually aren't really terribly helpful for these same folks who are often encouraged to use with others to avoid fatal overdoses. I'm wondering what the province is doing to address this problem and to help these people who are at risk.
Yeah, I'm going to pass this over to the Minister. Thank you.
Thank you. As we announced today, we've established a mental health command table that has the best minds in the province of Ontario coming together to look at the issues and ensuring that we have a system that continues to work even though we're telling everyone to stay at home. So there are support services that are available. There are methods for individuals to get in contact with us, whether it be through ontario.ca, which will provide the virtual supports or the connections to the virtual supports or the other helplines that are available. We are working to ensure that everyone gets the help when and where they need it. Thank
you. And Premier, on another topic today, British Columbia's Chief Medical Officer of Health said recently that she has been in contact with the World Health Organization to talk about the possibility of Vancouver acting as, I guess, some sort of a hub city for the NHL if there were to be a hockey season this year. I'm wondering if the province has been contacted by the league, if it's been in contact with the Toronto Maple Leafs, or if it's been in contact with the World Health Organization to explore any possibility of the hockey season resuming this year in Toronto as a city acting as a hub city.
I have been in contact, or they've been in contact with me, MLSE, and they're coming up with a game plan as a NHL as a whole. And they haven't really divulged anything else as of yet, but we have had a conversation. So once I get more information, I'll be able to pass it along to the people out there.
Next question.
Your next question comes from Tina Yazdani with City News. Please go ahead.
Hi, Premier. Thanks for taking my question.
Thank you.
I wanted to ask about the number of daily tests being completed in Ontario. On Sunday, the province hit a record high with 17,000 tests, but today we're down to 10,000 once again. There is capacity in the system to do more testing now, so why isn't the province using its full testing capacity? And how can we even think about reopening when we don't have a clear picture of how this virus is spreading in our communities?
So I was on good question. I was on here last few days saying they're doing a great job. They were hitting 17,000 consistently, and then all of a sudden you come in and you see the 10,000. I still say everyone's doing a great job, but when I looked at the chart, I'm going to get back on the table this afternoon. But when I look at the chart, it starts up here and it goes all the way down, and there's certain medical officers in certain jurisdictions. Now, keep in mind, we have 34 chief medical officers across the province. Some just aren't performing. I'm calling them out right now. You got to pick up the pace when you have a whole bunch of them, half of them really exceeding expectations, and then you have some others that just aren't even putting the work in as far as I can see. So we need to hold these people accountable, and that goes back to my conversation about after this is over, we need to review it and start looking at the Alberta model. It's a lot easier to have one person in control than 34 people in control. And I'll tell you right now, I'm disappointed on the chief medical officers in certain regions. I'm not going to name them. They know who they are. Start picking up your socks and start doing testing. I don't know what the big problem is with them testing. It's frustrating as anything. So sorry, but it gets frustrating. They need to pick it up, and as simple as that. And we'll be speaking to them over the next day or two and find out the reason they just are not testing to the capacity that they should be testing.
Follow up?
Okay, and just to follow up on that, we are still hearing stories of people being turned away from testing. There are still limitations on who qualifies for a test. So I'm just wondering when some of these rules might be modified to accommodate more of the public.
Well, we've been seeing the testing ramp up on all long-term care, and we need every single long-term care patient and frontline healthcare worker tested. I just don't know how much more complicated that can be. Go out there and start testing, and start working on retirement homes and the workers there, and start working on the healthcare workers, and then we have to also test the public. These people are smart people. Just continue testing. It's frustrating to say the least. And don't get me wrong, there's other chief medical officers that are knocking it out of the park, but half of them aren't. So we're going to have to get on the phone with them and find out what reason, what excuse they're going to give us why they aren't testing.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hey, good afternoon, Premier. The hydro subsidy, giving people around-the-clock access to the lowest hydro rates, that ends this week, I believe. Is that going to be extended?
Yes.
Care to elaborate?
Well, I can't. Number one, I'm not going to get in the weeds, Colin, but it was an absolute disaster. We inherited this hydro mess, and just trying to dig ourselves out of this. It's not going to be easy, but yes, it's going to be extended for a little bit, and that announcement will come later in the week there.
Okay, thank you. And I just had a follow-up. Premier, there seems to be, just going back to cottage country, there seems to be two sets of rules here. People who own a second home are being told that they are basically free to travel north and enjoy the fresh air. Mm-hmm. Thousands of people who live in apartments all across the province and basically cannot afford a second home, or even one home for that matter, they're being told, stay inside. You cannot go to a park. It is against the rules to go to a public pool. It's against the rules to go to a playground. How is that fair, Premier? And will we all get to go outside as well during the May 2-4 long weekend?
Yes, you will be. I understand and I agree with you 100%, Colin. It's not fair, and we'll have some good announcements moving forward this week.
Last question.
Your final question comes from Robert Benzie with the Toronto Star. Please go ahead.
Hi, Robert.
Good afternoon, Premier. The Chief Medical Officer of Health in Haldimand, Norfolk, has sent a memo to cottage owners there that if it's their second home, they're not allowed to visit their cottages. I think this is the first place in Ontario that this has happened, and some of the cottagers have been contacting us, and they're pretty upset about that. I just wonder what you think about this.
I don't blame them. Depending on the health, again, health and well-being of the people of Ontario. The public domain, we're seeing some positive results. And to say 3 weeks down the road, I don't know how he can predict, he or she, kind of first time I've heard of this, how can you predict 3 weeks down the road? We're doing pretty good. And then how do you tell people that are paying taxes and paying the bills for the vast majority of the people there to stay home? You know, people are cooperating. People have been very, very understanding. They've been excellent cottage owners. Just on the word of mouth, they haven't gone up there. And secondly, do you have enough bylaw officers? Do you have enough police to enforce this? The answer is no, you don't. So I have an idea. Why don't we work together, the same way we've been working together from day one, all of us in Ontario, and we'll have to make a call to him or her and find out what the issue is. But I still, how do you still tell people, don't go up to your seasonal cottage? It's going to be tough. People are doing a great job not going up.
And following up on your earlier comment about the local medical officers of health, and you said half of them aren't doing their job, and you're blaming a lot of the lack of testing on them. In Alberta, they have a different structure of how they have their healthcare system than we have. Are you gonna move toward that once this pandemic is over? So we're not going to have 34 separate public health departments across the province, and we'll have a much more centralized kind of system like they have in Alberta?
Well, I've always believed in centralizing, standardizing. It just makes things go a lot smoother. And it's a lot easier to hold one person accountable than 34 people accountable. So that's something we can look at. I can't say we're going to go that way, but again, with collaboration of our health team and people across the province and the mayors as well, we have to sit down and come up with a better solution than the results I'm seeing today. And I'm not saying they aren't doing their job. I'm saying they aren't performing. When you have 34 of them, you see 17 of them performing extremely well, and then you see the other 17, the tier looks like a ski slope going down. I just want to ask them, what's the problem? Why aren't you testing? And hopefully they can come up with a pretty legitimate excuse. And I can't think of any excuses right now. When I talk to our health team, they can't give me any reason as well. So we're going to be onto them. They have to pick their socks up. We have to work as a province. We've been working as a province this whole pandemic. People are incredible. Media's been incredible. Companies have been incredible. So they need to start testing a lot more, in my opinion.
Thank you.
But thank you so much, everyone. Thank you.